Hi, my name is Pouya Hemmati. I'm a staff cardiovascular surgeon with the Baptist Health Cardiovascular Surgery Clinic. I did undergrad at Johns Hopkins and then back home to Minnesota for University of Minnesota Medical School. And then I did all my training, residency, and fellowship at Mayo Clinic in the main campus in Rochester, Minnesota for general cardiac and thoracic surgery. So cardiovascular surgery focuses on surgery of the heart and the great vessels, predominantly the aorta. So most of our practice focuses on the coronaries, which are the blood vessels that supply blood to the heart, the four valves inside the heart, most often the mitral and the aortic valve, and then other procedures that involve the first portion of the aorta, the main blood vessel that exits the heart, and then other diseases that involve the cardiovascular system. One of the things that I took away from my training, one of the mottos at Mayo Clinic was the needs of the patient come first, and so I try to just stick to that. It's simple but clear. It's just that, you know, when a patient entrusts you essentially with their life and their care, you need to just do the utmost, you have the utmost respect for that, and also just cater to what they need. Some people may not necessarily want an operation, so even though it may be indicated, you need to spend the time, whether it's in a clinic or in the hospitals, just see what are their actual needs, what are their hopes, what's meaningful to them. And so I think that patient-centered care instead of just a procedure-centered approach is of utmost importance. My kind of motto that I got from my dad was always, you know, treat patients like they're your own family member. So if you come in, I think of you like my father, my mother, my sister, brother. So I try to give you the same care that I would expect if my family member went in to see another physician. We just want to be focused on what's best for the patient. I think one of the things that makes our program unique is that between the four surgeons that we have here, we all have different subspecialties, but we also come from different training backgrounds, and we actually work together truly as a team, so that if I get a referral and I think it's better suited to one of my partners, I will either send the patient there or we will do the case together. And so we do a lot of combined cases where I may do the arrhythmia surgery portion of the case, or one of my partners may do the aortic, complex aortic portion of the case. So the bottom line is, again, thinking about, you know, how you want your family member treated. We will have the best people doing the best portion of the case together with a team-based approach to optimize the outcome. I've been here almost a year now, and I like to get outside, go hiking. I'm from Minnesota, so it's nice to actually be able to spend more time outside than 4 or 5 months out of the year. So I've gone hiking, explored, you know, the rest of the state, Northwest Arkansas. I go to the gym every day, play basketball, tennis, lift, and then I do try to travel when it's possible to get away.